Yeah, so I'm Richard Smith and I'm the chair of the foundation and delighted to be so. I'm best known for what I'm not. I used to be the editor of the BMJ and the chief executive of the BMJ Publishing Group. I've done quite a lot of things since then. One of them was to chair for 6 years the board of ICDDRB, which used to be called the International Centre for Diarrheal Disease Research in Bangladesh, a truly extraordinary organization and a very bizarre and dysfunctional board that got a little bit better. So I've had a lot of experiences of boards. And these days, I'm also the chair of the UK Health Alliance on Climate Change, which brings together most of the big health organizations in Britain, all the medical colleges, the nurses, the pharmacists, the paramedics. I'm also the chair of Patients Know Best, which is a company that sucks together the records from general practice, hospitals, mental health, social care, and puts them under the control of the patient. And I was also, until recently, the co-chair of the Lancet Commission on the Value of Death. So I do a lot of things, but this position is very important to me.
Thanks, Richard. And for the benefit of the watcher, I should probably say who I am as well. So I'm Bev Fitzsimons, and I'm the current chief executive of the Point of Care Foundation and have been with the team for about 14 years now. So I just thought it might be useful, Richard, for you to just say a little bit about what your experience is like of this Point of Care Foundation board and how you found it.
Well, that's in a way why I mentioned the board of ICDDRB, because that was a profoundly dysfunctional board that did get a bit better while I was there. In contrast, I think the foundation board is an excellent board. When I first became the chair back in 2019, the board was bigger than the staff, which seemed a bit odd to me. And there were a lot of grand people from the NHS. I mean, people who have been very important in the establishing of the foundation. But it seemed to me we'd be better off with a smaller board that had more experience of smaller organizations like the foundation. And that's sort of what we've arrived at now. And I think it's a board that works well together. We don't have to agree about everything. We can disagree and respect each other. A lot of the board are increasingly involved with the foundation staff. So it's not a sort of them and us. We work very much together in a way that, to be honest, although I've been on a lot of boards, I've not really experienced before. And I think the board and the staff, so all of the staff come to most of the board meetings and they contribute. And I think if you came into some of the board meetings, you wouldn't be entirely sure who was staff and who was on the board. So we work well together, which I think is really important. I think a them and us culture can be very divisive. So right at the moment, I feel very good about the board. And I think you could perhaps confirm, Bev, we manage to recognize that we're the board, we're trustees, we're not the executive, we're not running the organization. And it's, sometimes it can be tricky to get that balance entirely right, but I think it feels to me like it's right most of the time.
Yeah, I'd agree, Richard. And I think the more collaborative working between subgroups of the trustees and the staff has been really successful and has brought extra richness to the conversation. So I think that's been a really good development. So the sort of $64,000 question is, what do you think the board is looking for in the new chief exec?
Well, we're looking for somebody that we can work with comfortably and will enjoy working with us. And I think the first thing I'd say is that we are a mission-driven organization. We're about humanizing healthcare, improving dignity, compassion, being kind to patients and people in care homes. And I think you've really got to be signed up to the mission. If you're not signed up to the mission, then you shouldn't really be applying. And I think it's important as well to recognize that, very much part of our philosophy is that you can't really expect staff in the NHS and care homes and other carers to be kind and compassionate and behave in a very humane way if they're not treated that way themselves. And I have to say that a lot of the time in the NHS, I think it feels to staff like they're not treated that way. So we're interested in staff and patients. We would like to do more. I mean, we're a small organisation. The NHS is huge. Social care is big. And in many ways, I'd like us to be able to do much more with social care. So, we're interested in a leader, someone who's a strategic thinker who can really help us move on and have still more influence, which doesn't necessarily mean that, we'll be a bigger organization, but we must find a way to have as much influence as we can in humanizing care. We want someone who's a team player. That's going to be very important. I mean, we don't want a lone leader who wants to be out on his or her own doing things. We need a leader who works with the team and is interested to develop people and move them on. I think we've got good staff, but they're all going to be keen to develop their skills more. You need to be flexible. It's a small organization. It's sort of all hands to the pump at times. You've got to enjoy diversity. We are very much believe that diversity brings huge value. So the more diverse we can be in ourselves, but also with the people we work with, that's important. You need to be comfortable with sort of complexity and uncertainty. I think that's true these days of all organizations, but it's certainly true for us. You've got to be capable of working with the many different sorts of stakeholders, the staff, the customers, patients, the board, the broader world. I mean, again, as with all organizations, there's multiple groups of stakeholders you've got to be comfortable with. We would like someone with financial and business sense. We work very much as a business organization in the sense that although we're not interested in making huge profits that we redistribute to shareholders, we sort of believe that if we do things that are of value to our customers, then they'll come to us and they'll want more. We can generate a surplus, which we can then invest in developing new products. So we do, having financial and business sense is something we would very much like. We care about sustainability. And I think in many ways, the NHS is at the moment is probably not sustainable. So there's a lot of thinking to go on there, and I think we can help. You'll need to represent the organization, so being comfortable with public speaking and making presentations will be important. And ideally, you will know the NHS and the care system. I mean, that's not absolutely essential. I mean, because we've got a lot of people around who know about that, but it's obviously something that probably most of the people apply will have. But that's a hell of a list. And I wanted to end by saying, we're not looking for a super person. I mean, we recognize that people will come along who have many of these things, but don't necessarily have all of them. So I think if you think, well, I really care about that mission, I've got a lot of those things, you should think about applying. We're not expecting to appoint a god or a goddess.
So, Richard, just to finish off, what would you say were the biggest challenges for someone coming into this post, and what are the biggest opportunities about working in a small and growing social enterprise?
So I think that the first sort of question in my mind is, how can we maximize our impact and influence? I mean, that may well be through growing the organization, but perhaps we might work in a different way. I don't know, a franchise model or something. That's one question. I think you need to recognize that with small organizations, you can move quite quickly from feast to famine. I mean, at the moment, we're in a good position, but you can never be quite sure. And I think that's one of the challenges that's stronger in a small organization than in a bigger organization. I think balancing the mission and the business, as I put it in inverted commas, is important. We don't ever want to forget the mission, but at the same time, we want the business to kind of grow and develop and have more resources that we can invest in new programs, new projects. Being willing to muck in. I mean, that's one other thing about a small organization. You may suddenly, people are off sick, you've got to step into the breach, something's happening. You can't sort of sit in a chair and be strategic all day long. You've got to get in there. But then I think the great sort of benefit of a smaller organization is you can know everybody, you can know all the staff, all the trustees, many of the people we work with. You can be very hands-on. And I think for the kind of person who's going to apply for this, that's going to be a virtue. You're not someone who wants to dream big dreams. You want to get on and do things. And you've got marvelous people that you can work with to develop. So as with all jobs, there are challenges and there are opportunities. And I hope you'll think about applying.
Brilliant. Thank you.